Welcome to Landmark Home Health Care's Hand Hygiene Guidelines Training Program, Session 2. You will be required to view and to listen to this presentation. Following this presentation, you will see a third presentation that you will be asked to participate, and then after that, you will be required to take a test. There is substantial evidence that hand hygiene reduces the incidence of infections. Semmelweis, a physician in Vienna, demonstrated that the mortality rate among mothers who delivered in the first obstetrics clinic at the General Hospital of Vienna was significantly lower when hospital staff cleansed their hands with an antiseptic agent than when they washed their hands with plain soap and water. In more recent studies, healthcare-associated infection rates were lower than antiseptic hand washing was performed by personnel and went down when adherence to recommended hand hygiene practices were improved. In 1846, Ignaz Semmelweis observed that women whose babies were delivered by students and physicians in the first clinic at the General Hospital of Vienna consistently had a higher mortality rate than those whose babies were delivered by midwives in the second clinic. He noted that physicians who went directly from the autopsy suite to the obstetrics ward had a disagreeable odor on their hands despite washing their hands with soap and water upon entering the obstetrics suite. His theory, puerperal fever, which was causing the deaths, was caused by, quote, cadaverous particles, end quote, transmitted from the autopsy suite to the obstetrics wards via the hands of students and physicians. The intervention in May 1847, Semmelweis insisted that students and physicians clean their hands with a chloride solution, similar to the one pictured here, between each patient in the clinic. After Semmelweis insisted that students and physicians clean their hands with the chlorine solution between each patient, the maternal mortality or death rate in the first clinic dropped. The maternal mortality rate in the first clinic dropped dramatically and remained low for years. This is the first evidence indicating that cleansing heavily contaminated hands with an antiseptic agent between patient contacts may reduce healthcare-associated transmission of contagious diseases more effectively than hand washing with plain soap and water. The iceberg effect. This iceberg graphically represents colonization versus infection. Those patients that are infected with an organism represent just the tip of the iceberg of patients that are colonized or infected. Just because a patient is not infected or showing signs of infection does not mean that they do not carry organisms that can be transmitted from one patient to another if proper hand hygiene and other infection control precautions are not taken. Colonized or infected, what is the difference? People who carry bacteria without evidence of infection are colonized. If an infection develops, it is usually from bacteria that colonize patients. Bacteria that colonize patients can be transmitted from one patient to the other through the hands of healthcare workers. MRSA, methicillin-resistant Staph aureus, is a type of staph bacteria that is resistant to certain antibiotics called beta-lactams. These antibiotics include methicillin and other more common antibiotics such as oxacillin, penicillin, and amoxicillin. In the community, most MRSA or MRSA infections are skin infections. More severe or potentially life-threatening MRSA infections occur most frequently among patients in healthcare settings. While 25 to 30% of people who are colonized in the nose with staph, less than 2% are colonized with MRSA or methicillin-resistant Staph aureus. VRE, vancomycin-resistant enterococcus. What is vancomycin-resistant enterococci? Enterococci are bacteria that are normally present in the human intestines and in the female genital tract and are often found in the environment. These bacteria can sometimes cause infections. Vancomycin is an antibiotic that is used to treat some drug-resistant infections caused by enterococci. In some instances, enterococci have become resistant to this drug and thus are called vancomycin-resistant enterococci, or VRE. Most VRE infections occur in hospitals. Recovery of VRE from hands and environmental surfaces. Many patients in the hospital acquire vancomycin-resistant enterococci, or VRE, from another patient, potentially via the hands of healthcare workers. In epidemiologic investigations of contamination of hands of healthcare workers with VRE, up to 41% of hands sampled were positive for VRE. VRE has been recovered from a number of environmental surfaces in patient rooms, including patient and healthcare worker gowns, door handles, cabinets, floors, blood pressure cuffs, bed rails, urinals, bedpans, and toilet seats. In one study, VRE survived on a countertop for up to 7 days. In one study, hands of 131 healthcare workers were cultured before and hands and gloves after routine care. A mean of 56% of body sites and 17% of environmental sites were VRE positive. After touching the patient and the environment, 75% of ungloved healthcare workers' hands and 9% of gloved healthcare worker hands were contaminated with VRE. After touching only the environment, 21% of ungloved and 0% of gloved healthcare workers' hands were contaminated. The inanimate environment plays a role in facilitating the transmission of organisms. A survey question. When a healthcare worker touches a patient who was colonized but not infected with resistant organisms, for example MRSA or VRE, the healthcare worker's hands are a source for spreading resistant organisms to other patients. Answer: strongly agree, agree, don't know, disagree, or strongly disagree. The correct answer is strongly agree or agree. Patients that are colonized but not infected with bacteria can still contaminate the hands of healthcare workers, who can then spread the organisms to other patients unless proper hand hygiene is practiced. A co-worker who examines a patient with VRE, then borrows my pen without cleaning his or her hands, is likely to contaminate my pen with VRE. Do you strongly agree, agree, don't know, disagree, or strongly disagree? The correct answer is strongly agree or agree. Many patients in the hospital acquire VRE from another patient, potentially via the hands of healthcare workers. In epidemiologic investigations of contamination of the hands of healthcare workers with VRE, up to 41% of hands sampled were positive for VRE. This is one of the materials distributed by the CDC, Centers for Disease Control, to improve hand hygiene in healthcare settings. This concludes Session 2. Please proceed to Session 3. Thank you.